It is my honor and pleasure to introduce our keynote speaker for today's PASCOM General Assembly. I had the opportunity to first work with our keynote speaker when I was still a resident physician trainee at the Department of Family and Community Medicine at the UP Manila Philippine General Hospital way back in 2004. At first, I remember referring to him as the better half of a dear faculty mentor in community medicine, Dr. Elizabeth R. Paterno. Later on, I got to know him at a more personal and professional level when I became active with endeavors of the Philippine Academic Society of Social and Community Medicine. Our esteemed speaker obtained his baccalaureate degree of Bachelor of Science in Molecular Biophysics and Biochemistry from Yale University in 1971. He later on pursued his Doctor of Medicine degree from the University of the Philippines Manila College of Medicine in 1976. In 2005, he earned his Master of Public Health from the University of the Philippines Los Baños Open University. A true scholar ng bayan, our keynote speaker served the UP Manila National Institutes of Health from 2005 to 2014. During this period, our keynote speaker devoted his precious time and energy to champion primary healthcare and was a staunch advocate of universal healthcare. From 2005 to 2011, he headed the UPM NIH PhilHealth Validation Study Group, and he proactively served the UPM Universal Healthcare Study Group that played the pivotal role in the enactment of Republic Act 11223. As a prolific researcher in the field of public health and health policy development, our keynote speaker authored several publications, including Universal Healthcare for Filipinos, a proposal on health financing, and validation of the selection process of PhilHealth-sponsored members in 4 barangays in a municipality in Batangas using participatory action research, both of which have been published in Acta Medica Filipina. As a UP President Edgardo J. Angara Fellow from 2010 to 2011, our keynote speaker also developed a health policy position paper on how to finance universal healthcare, and he also completed several papers as initiatives of the Department of Health and the Department of Science and Technology, Philippine Council on Health Research and Development. In particular, our keynote speaker worked on the research entitled Reconfiguring Primary Healthcare in the Context of Universal Healthcare, as well as Tracking Kalusugang Pangkalahatan Implementation at the national level from 2010 to 2013. During his term as PASCOM National President from 2013 to 2014, he presented a proposal entitled Emerging Competencies of Graduates and Faculty of Medical Colleges in the Philippines, Responsive to its Socioeconomic Context and Emerging Health Needs, to the Asia-Pacific Action Alliance on Human Resources for Health. In 2014, he was the Ibaraki Kasumigaura Awardee for the paper The Yaman ng Lawa Initiative in Santa Rosa City, Philippines, an inclusive participatory approach to public policy development. Our keynote speaker's experience in primary healthcare spans the spectrum of a community-based health program of non-government organizations in the Cordillera region to a network of urban primary care clinics for the underserved, and as consultant of the Doctors to the Barrio program of the Department of Health. Fellow lifelong learners and six-star physicians, let us warmly welcome Dr. Ramon Pedro Paterno.
Good afternoon. Welcome address. I almost said I don't think I have to talk anymore because actually Cherry has already summarized my presentation. What I'd like to achieve in this presentation is that at the end of the session, Hopefully, participants will be able to describe the kind of heroes needed for Health for All Filipinos, initiate the acknowledgement of heroes within the health sector who have contributed to the goal of Health for All Filipinos, and the participant hopefully will be able to make a list of their own heroes to serve as their inspiration. For the session, I would like it to be the start of the compilation of all the heroes who contributed and continue to contribute towards the achievement of health for all Filipinos. Us, it's also fitting for us since National Heroes Day will be 2 days from now in August 28, 2023. And I'd like to start with the traditional definition of hero, a mythological or legendary figure, often of divine descent, endowed with great strength or ability, an illustrious warrior, one who shows great courage. If we hold ourselves to this definition, I doubt if any one of us can claim divine descent. So I'd like to propose a more popular definition, uh, namely ordinary people who rise up to meet extraordinary challenges. No? The stress here is ordinary people. Another definition is a hero is someone who, in spite of weakness, doubt, or not always knowing the answer, goes ahead and overcomes anyway. And that comes from Christopher Reeve or Superman. Another definition is heroes are ordinary people who make themselves extraordinary by Jerry Way. Who is Gerard Way? Well, I had to look him up. Turns out he's a popular singer. Uh, so I'd like to combine our popular definition with the principles of community organizing. A hero is one who's able to work with and not just for the people, such that in the end, the people can say, we did it ourselves. So our heroes would be ordinary people who are able to meet extraordinary challenges and in the process are able to work with people such that in the end, the people can say, we were able to do it ourselves. I also thought it might be a good idea if I crowdsource with the question, who do colleagues consider as heroes for Health for All Filipinos? My limitation is that my colleagues mainly revolved around the members of PASCOM. Well, let me start with my historical hero. Way back in 1847, Dr. Rudolf Virchow already started with a revolutionary remedy for epidemics. No? He's a doctor who founded social medicine and founded the discipline of anthropology and had the good fortune of working with our national hero, Jose Rizal. And so, what was his remedy for epidemics no? As early as 1847? Is it more medical missions, more medicines, as we often do for floods? It was prosperity, education, and liberty. Now, I think that's very revolutionary prescription to remedy epidemic. Now, bien nielos And Dr. Arcadio also nominated Dr. Juan Flavier, who in the 1970s published the book Doctor to the Barrio. And this was in sharp contrast to the traditional hospital and urban centric pathway of the majority of medical graduates and inspired doctors to go and practice in the barrio. Again, Dr. Arcadio recommended that the UP Manila School of Health Science also be considered as an organization that is heroic, initiated by then UP College of Medicine Dean Florentino Herrera and team. It is recognized globally as a model for step-ladder medical curriculum. It should be the model for all state medical schools. And the latest School of Health Science that we have is at Tarlac in partnership with Tarlac Province. The rural missionaries were established. They established community-based health program 3 years even before the declaration of primary health care at Alma Ata. In the background paper for the WHO Commission on Social Determinants, it acknowledged three contributions that led to the Alma Ata Primary Health Declaration. The first, China's Barefoot Doctors Program. Second, South America's liberation theology expressed as basic Christian community organizing, and the Philippines' own community-based health program pioneered by the rural missionary. Uh, the names in parentheses are those colleagues who recommended the following organization. Katiwala Program. The Katiwala Program was started by Dr. Jess and Trining de la Paz of Davao. It involved the training of volunteer village health providers. And another distinction of the De La Paz couple was they were the co-founders of Davao Medical School Foundation. And I have been informed by Jean Lindo the Davao Medical School Foundation made community medicine its flagship program. GB Tan and the community-based health program. They provided the means for young graduates in the 1970s to go to the communities, to live with them, to learn from them, to celebrate from them, to train community health workers in the Cordilleras. And recently, the Thunders of CBHP had a reunion. Yung Thunders raw yung AKA matatanda ng community-based health program. This one is from Bien Nilios. He recommended, and I think rightly so, the recognition of thousands of municipal health officers who stayed in their position in the rural areas through the difficult times of martial law and the adjustment needed when they were devolved. And all of a sudden, from the DOH, the central DOH, they were now under the local chief executive. The Community Medicine Development Foundation by Lynn Redoble, the Doctors to the Barrio program were patterned after ComMed's Doctor Deployment Program. And then we have in 1978 the Declaration of Alma Ata, and it had persisted. In 1978, the first time that the WHO declared health for all is possible and should be the goal for all. 30 years after, the WHO reiterates primary health care now more than ever. And then 40 years after 1978, the WHO in the Almaty Declaration uh, pushed for universal health coverage, still guided by primary health care. An interesting note, in 2022, G.H. Brundtland, WHO Director General, during Alma Ata's Regional Declaration in 1978, now a member of WHO, the elders, continues to advocate, and I quote, public financing for primary health care is key to universal health care, as reported in the Lancet Global Health Commission's 2022. And then in, we have the Justice for Aquino, Justice for All, as a prelude to the EDSA revolution. When Ninoy Aquino was assassinated, there was the call for justice, not just for Ninoy Aquino, but for all the victims of martial law. And we had Dr. Bobby de la Paz, Dr. Juan Escandor, Ed Hobson, and Makliing Dulag. No. I would love to talk more about Makliing Dulag, but in the interest of time, I will reserve that for a later discussion. There are those who have died or who have left us, and for our heroes have gone before us, some due to illness, like Minda Luz Quesada, who is known for many of us as the nurse professor in UP Manila College of Public Health, who also advocated for Health for All Filipinos. Mary Vita Jackson, Dean of PLM College of Nursing, and Dr. Daniel de la Paz, husband of Delen de la Paz, who started as a community-based health program doctor in Samar, taught surgery to the community medicine alternative residency. As mentioned before, there were victims during the martial law, the Bobby de la Paz, Janice Candor, Jopay Padkayan, a nurse in Isabela, and Dr. Kirk Salet, a dentist in Sama. And there were heroes killed after martial law, Dr. Dreyfus Perlas, Dr. Studbario, then rural health physician, killed in Lanao, Dr. George Repique, provincial health officer of Cavite, Dr. Lourdes Tanco in a military raid in Baguio City, Dr. Avelox Amor, doctor in Negros Occidental, red tagged and killed, Dr. Mary Rose Tancelan, also red tagged and killed in Gihulngan, Negros Oriental, and Dr. Raul Andutat. This is not a complete list, and as I had shared before, we should have a continuing project to compile a more complete list. The UP Manila's Community Health and Development Program. The forerunner of the UP CHDP was the UP Comprehensive Community Health Program, or CCHP, initiated by Dr. Pablo Campos. And it was an example of the university taking over the running of a part of an LGU's health system as training for medical and nursing students. I was reminded of the CCHP by Dr. Arcadio. The Community Health and Development Program, however, took a different approach from the CBHPs of the 70s and the CCHP approach. It was essentially an attempt by academe to work with local government. If health is a right, if health as a right means it's primarily government's responsibility to fulfill health as a right, then government cannot be ignored. And the realization of health as a right cannot be done only by NGOs, such as the community-based health program approach. Another figure that comes in is William Latham, who wrote or who edited The Future of Academic Community Medicine, which describes the academe as an instrument for social change, wherein the whole university is mobilized to use its resources to address society's needs. We have we are fortunate that I was able to find a presentation of our own Dr. Gina Itchon from Xavier University addressing the aftermath of a storm in Cagayan de Oro. And here was her presentation. Gina Itchon was a member of PASCOM. This was her presentation for the PASCOM Annual General Assembly in May 2013. And she was an officer of PASCOM then. And if you note, she was the director of Sustainable Sanitation Center. And note also, is it by serendipity? The name of her school is the Xavier University uh, Jose Rizal Medical School. So what did she do? After the storm, she had to meet with the engineers in Xavier School and discuss with them, plan with them to what would be the best efforts to address the major problem of Cagayan de Oro devastated by Typhoon Sendong. Was it to organize more medical missions? Actually, they installed more UDDTs at the West City Central School Evacuation Center. Frankly, I had to look up what UDDTs were, and it turned out it is a urine diverting dry toilet when a disaster area is beset with problems with water supply. Ironically, this was the same problem we faced in the Cordilleras where water-sealed toilets were not feasible. Uh, uh, the UDDT, apparently, when you divert urine from the uh, pit that you build that collects the stool does not emit an offensive smell, and the toilet becomes usable. And then in December 21, Xavier University committed to develop 5 hectares of the university's property to be used as relocation site for 550 households as its contribution to the rehabilitation and resettlement efforts of the city. Note again, they didn't organize medical missions to meet health needs of those in the resettlement or rehabilitation area. Now, I go. I would also like to recommend the Universal Healthcare Study Group with Jaime Galvez Tan as heroes in putting universal health care or in the time of Pinoy, kalusugan pangkalahatan on the in the Aquino health agenda. This was the PAFP convention in February 2010, where Pinoy and Gordon were the presidentiables who attended. The ones in Barong, including Cesa Quinn, were members of the Universal Healthcare Study Group. The role of Jimmy Tan, he headed the doctors for Aquino, and he wrote the speech of Pinoy. So when Pinoy responded to our call for universal health care, he read and he promised to achieve universal health care within 2 years, which we knew was impossible, but universal health care became part of the national agenda. And in 2013, ex-Chief Justice Renato Puno advocated that Filipinos must demand the right to health, housing, education. But I was informed that it's not enough for health to be a constitutional right. We need a law to make the right to health justiciable, or you can bring its non-provision to the courts. So, in 2019, Republic Act 11223 or Universal Healthcare Law was signed, and I felt that certain people in the DOH, headed by Beverly Ho, were instrumental during the congressional deliberations of Universal Healthcare Bill in embedding primary healthcare philosophy and principle in the Universal Healthcare Law. This is a graphic representation of an all of health system, all of government approach to address the social determinants of health, and an all of society to achieve the primary healthcare goals of improved health outcomes and equity in health. In the Universal Healthcare Law, Chapter 1, Section 2C, it is stated the all of health systems, all of government, and all of society should be the framework for implementation and monitoring and evaluation of the Universal Healthcare Law. And another embedded item for achieving universal health care was the concept of addressing social determinants of health. In the general principle, Chapter 1, Section 2, it states, ensure all Filipinos are provided with healthy living conditions. When we as participants in the discussion regarding the UHC bill saw this, I kept quiet because I didn't want any of the other congressmen or senators to notice this section, which mandates the Philippine government to ensure all Filipinos are provided with healthy living conditions. Now, the Swillig Family Foundation, PLGP, is another vehicle, this time for younger graduates to serve. And they developed from municipal leadership and governance program to provincial leadership and governance program to address the fragmentation of the health system. Some members of the PLGP, of the Swillig Family Foundation PLGP, have continued as PHOs, provincial health officers, as assistant PHO. One of them is Jackie Monville, who is now the assistant PHO of Agusan del Sur. Again, we'd like to recognize Fernando Sanchez for the revival of PASCOM and the PASCOM, its officers and members. And this is a screenshot in a 2021 meeting. And you can look at how large PASCOM has become from its initial days of revival. Again, the APMC with the Executive Director, Dr. Arcadio, should be recognized, and the PASCOM in their partnership in advancing the reorientation of medical education. In this case, it was towards integration of primary health care and universal health care in teaching clinical specialty. Of course, we also recognize those who assisted in reorienting new medical schools like Dean Sulweta. The new medical schools and their deans, models of reorienting medical curriculum towards primary health care with focus on public health and primary care. To name some, but not limited to, the Bohol Island State University College of Medicine, the Cavite State University College of Medicine, and possibly, maybe in 2 weeks' time, the New Era College of Medicine. Other health professional associations, like the Public Health Nursing Association, Public Health Dental Association, Allied Medical Association, and all health professional education, not just the medical education with interest to be reoriented towards primary health care with focus on public health and primary care, using interprofessional education towards a primary health team approach, towards a health team approach, towards health for all Filipinos. Now, I'd like to end, or second to the last slide, with a quote from Dr. Alberto Romualdez, basically saying, uh, if the promise of universal healthcare is still not there, we should start getting impatient. And more importantly, we should make the people, the communities that are deprived, to be impatient and demand the right to universal health care. So let me end with Jose Rizal as a national hero with his quote, "Someday you will perhaps be a great physician, a great nurse, a great dentist, a great health professional if they let you go your way in peace. But greater yet be, will be he or she who can inject a new idea into this anemic people. You, what are you doing for the land that gave you existence, that supports your life, that affords you knowledge? Don't you realize that it is a useless life which is not consecrated to a great idea?" And what is that great idea? An independent, democratic, prosperous Philippines where all Filipinos are insured, healthy, living, schooling, working conditions. And, and as a result, health for all Filipinos can become a reality. Thank you very much.